So as everybody's coming into the lobby, we're going to get started here. As people trickle in, we're going to go ahead and share some industry statistics. So I'll go ahead and get that started here so that we can see those. There we go. Okay, so I can back up and re-welcome everybody to the CAH Billing Manager Panel event, Improving Patient Accounts Receivable. Welcome. This is from Coretech Brokers and Wix Corp. I want to thank everybody. And so as everyone's trickling in here, we're just going to run through some industry statistics that are of important note. So take some notes here. If you've got any questions on these for our panelists, that would be good. And let me just go through those. Then we're going to welcome everybody and get everybody moving along here for a good conversation. So some interesting data here, 2015, 2017, patient costs have been rising 30%. I can only imagine, and we all can only imagine, from 2017 to 2020, what that number looks like. Definitely the trend was up, and I'm sure it's continued. So that was pre-inflation. In 2021, the time to collect, the changes in accounts receivable, there was an increase of 49% in 2021. The time to collect, and 37% stayed the same and 15% decreased. Definitely some work that can be done there. 87% of consumers were surprised by their bill in 2021. 52% of Americans reported that they were on the financial brink. That's a bit scary. And 1/3 of Americans did not seek care due to costs. 47 is the percentage of family premiums that are up compared to wages or inflation. Now that was 2021. I'm not sure where we are today, but we know that that's not a good number and inflation's not good right now. 73% of consumers were confused by their medical bill. 73% of medical practices rank staffing as their top concern. And 83% of hospitals are non-compliant with price transparency. 70% versus 9%. That's the percentage of consumers that receive bills in the mail versus those that want to. I know for myself, I check my physical mail about once a week just to get all that junk mail cleared out. Healthcare could save $20 billion in costs by moving to electronic transactions. And $10 billion in admin costs due to low healthcare literacy and rising complexity. So those are some industry statistics that are important and of value to all of us. But now it's time to meet our panelists, and then we'll get going with some specific questions. So first, I want you to meet Brooke Taylor, and I need to run up here to my notes for Brooke. Brooke has been in the hospital billing manager for just over 6 years with 16 years of experience in medical office functions and support. She enjoys the interpersonal environment of a smaller hospital and small community. Her favorite hobbies are spending time with her family. Then we have with us Deanne Young, and Deanne is the business office supervisor of 3 clinics with Central Valley Medical Center. She has been with the Central Valley for 35 years, working in all aspects of the business office and front office. She loves her job and the challenges that come with it as they face the continuous changes that we're all seeing in the healthcare industry. She also loves spending time with her family, especially her super cute grandkids and her close-knit extended family. Then we have with us Mindy Gale, and Mindy is the business office manager for Beaver Valley Hospital and Milford Memorial Hospital. And when she's not working, she enjoys camping and her grandchild. Then we have the CEO of Wix Corp, Eric Wixom, and he's the co-founder and CEO of this patient engagement company. When he's not helping hospitals and clinics engage with their patients, he's either playing with his family or starting some new project. I'm your moderator, Clark Atwood. I'm an independent technology broker. We work just like an insurance broker. We work with clients that and they don't pay us, but we find solutions to their technology problems and their business problems, and then bring those to them. So I have too many hobbies to count, so I try to give up 2 of those. That was yard work and house repair, but I just couldn't do it long term for some reason. So that's all the slides you're going to see, except for at the end. So if we're going to jump right over here, let me get my screen where I can see our panelists easier. We're going to start off by letting you know that we've assembled a lot of questions. So our attendees here have given us a bunch of questions, and we're going to start off with Brooke. We're going to start off with you with a question, and we'll just go from there. So you're coming from a bit of a large...
Before you jump into that, Clark, you're still sharing your screen. If you want to unshare that so
please,
that our
thank you. Cameras
get nice and big again here.
Yep, give me just a second to do that. There we go. It got big for me. Thanks for that, Eric. Okay, so Brooke, coming from a bit larger institution, facing regional competitors, what were you looking for in a patient engagement company? Oh, you're on mute. You just got to take your mute off. Sorry.
Thanks for that reminder. Initially, when we started looking, we were trying to engage our patients, honestly, on a registration side. We needed to fix a few things, and so we started looking, and we felt like just instilling confidence and communication with our patients, kind of in a team way, was something that would be helpful. And that's when we sought out Red and some different things. But we feel like those 2 attributes are things that, when you have trust, the communication, the confidence, those 2 things will help increase not only your patients wanting to return, but we feel like it helps them to want to pay their bills. It just helps with that loyalty. And so that was kind of initially what we feel like patient engagement is in likeness to things that are going on in the industry, is the trust and communication.
Anyone else want to chime in on patient engagement? Okay, we'll go on to Mindy. And as our attendees, there's a chat. If you have questions for our panelists, you want some follow-up on any of these, please put it in the chat, and we'll get to that. So Mindy, Beaver and Milford hospitals are both in small, isolated communities. What are some of the unique challenges you're facing when it comes to patient financial engagement?
So I think one of the biggest problems that we were struggling with is that upfront collection process. We're on the hospital side of things, which is a little more difficult, I feel like, to collect that upfront payment. So that was one of the things that when we were looking, that Red was able to help us with. I think one of the biggest tools that we have had as far as patients is the real-time eligibility. Like, we have our admissions clerk who is able to now check insurance real-time and eligibility right as the patient is at registration. We didn't have that ability before, and that's been a game changer for us. Kind of changed the whole process in his office and cut back a lot of his time. Along with that, I would say that real-time eligibility has, and I don't know, this is kind of going down a little bit different road, but it's helped us with the denials that we have had on our claims. As we're doing that real-time eligibility and we're able to look at insurance and what their benefit is and making sure that it gets to the correct payer, our denials have definitely gone down.
On the denials, we did have a question. I'm going to jump to that real quick, just so we're on that topic. So you say it's helped with the denials. We do have one of our attendees that's been having a larger volume of denials on claims due to coordination of benefits needing to be updated. So can you just expand a little bit more on that and how that's really helped lower that denial piece?
So from an admissions side of things, previous to running the RED system, we were doing kind of a back-end check on our eligibility. And it was pretty time consuming because we didn't have an eligibility tool. So we were reaching out to payers, or living in a small community, we know a lot of our patients and they generally don't have their insurance cards with them. That's just, we know them from the grocery store or the post office. And so getting those patients to bring in an insurance card was hard. And so for us to be able to get on the portal and check eligibility and, then state back to the patient, okay, it looks like your Blue Cross was termed on this day. And then they say, oh, yes, I actually forgot. We switched over and we have, something different now. So it's really helped getting the claims to the correct spot, and the denials have been a lot less. As far as you were asking me a little bit about,
No, I think you've answered the process and what you physically go through to make sure that how it physically helps you on the denial side.
Yeah, the coordination of benefits. Sorry, that's what you were asking me about. As far as the coordination of benefits go, it's nice for us to be able to get in, and as you are checking eligibility, it gives you some information about the eligibility. So you're able to read down, through what the deductibles are, when the insurance, when they started with that insurance, when it maybe ended, and it's really super nice. I know that if you were to ask our admitting clerk right now if he could live without it, he would absolutely say no. No way. Don't take that away from him.
Awesome. Deanne, let's go to you for a second. You oversee the billing processes for the hospital, own medical clinics. What challenges were you seeing trying to assist patients as they transition between the clinic and the hospital billing processes?
One of our biggest struggles that we have and face is coming from the clinic side. We do all of the billing for our physicians, whether it be that they're seeing the patient in the clinic or in the emergency room or as an inpatient. And so all of the billing comes from the clinic, which does confuse patients, especially if they're not from our community. So if they're coming to the emergency department, they're confused on why they're getting two separate statements and one from an entity that they are not familiar with, which is our clinic. So I would say the going with RED has helped them because people are more apt to kind of go down that road electronically of searching if they get that electronic notification to inquire more on what it is, and then they're able to see the detail and be able to identify the physician's billing statement as separate than the facility's statement, as opposed to that paper statement that they may get in the mail and never open, assume it's a duplicate or whatnot that way. Another challenge along that same way is our two outlining clinics that may have their labs done at that clinic or their lab draw done, and then the labs are brought to our facility, Central Valley, to run. And so they're getting those two separate billing charges from the clinic and facility, but going online, it seems to be easier and make more sense to them than avoiding opening that paper statement.
Because they're physically there together, they can see everything in one place, and then they have the confidence to know, yes, I do owe this. Yes, I can see this, even though it's from two different sources. Right. Awesome. So Eric, we've already just talked about three issues that RED addresses. Let's talk about, Wix-Corp's approach in tackling these issues. We've got a lot of other questions here, but why don't we just take a second and talk about your overall approach and how we're tackling these things?
Absolutely. So Wix-Corp is a patient engagement and experience company, right? Our goal is to be that connective tissue between patient and provider across all those different touch points. And so I love kind of your intro questions here, Clark, because it's highlighting that from a patient experience, it's all these pieces together, right? It's not just the paper statement that I got. It's not just who did I talk to when I went in to schedule and register and talk to the admitting clerk, right? The patient experience covers that entire continuum, right? From the very first awareness of their seeking care all the way through final payment. Our goal is to try and look at each institution and understand what are those business processes today and how does that make sense and what do we need to do for the patient. And so the experience that Mindy was talking about with her admitting clerk and how he manages that intake process, completely different than the way that Central Valley's team does it, right? So as we look at the patient experience, it's extremely unique to each institution. And so one of the things that we really try hard to do is understand how does that institution function. So like for Central Valley with Brooke and Deanne, where they have the multiple clinics and hospitals trying to play together, those are all the dynamics we try to think about and understand how can technology help improve those areas and where does it make sense to engage the patient in that process.
So just briefly, I mean, we're talking about different systems, different processes. How does WixCorp adapt those things? I mean, if you've got a different back office system, billing system, EHR, EMR, you've got these different systems in the back end. How does WixCorp glue it all together to make it a seamless presentation to the customer, to the patient?
Very carefully, is the short answer. You're right. So every institution has different EMRs that they're using. They have different processes and business flows. They have an entirely different both technology ecosystem and business process, and how those two come together are very important. And so we work really hard on the front end to try and understand those processes. And then we do a lot of parameter-based settings within our platform to turn on and off and move things around so that it makes sense for that institution, because it has to work for the patient, right? As soon as the patient is going through, if they hit a roadblock that doesn't make sense with how things are flowing, you've lost it, right? And so we have to make sure that that's flowing nicely. So from a technology perspective, it just means we have to be very adaptive. So whether we're integrating real time with an EMR and bringing data back and forth real time and being able to mirror all that out to the patient, or whether we're doing a batch file process with a different EMR that we have to put a slight delay on so that it feels real time to the patient, right? It's all of that nuance in the setup process so that once we're actually turning it on, the patients are having a good experience. And that the support teams have the tools that they need to be able to help manage those experiences.
Mindy, I see you nodding your head. So it sounds to me like what you're able to do is let the business drive the technology, not the technology has to drive the business. Is that a fair statement in this case?
Yeah, I think that's fair. I was just going to say, as Eric was talking, I remember as we were launching this, asking Eric, okay, so what am I going to expect from the patients? And exactly what he told me was true. He said they're going to love it, and they do love it. Like we have patients daily that call us, oh, I love this new system. I love that I can see the details of what my charges were and that my insurance is paid, and now it's, my turn to pay. So we have had such a great experience with our patients just loving the system. They love the portal. Once you get them in there, they really do love it.
Excellent. So Eric, here's your task. While I'm going on to the next question, you need to bring up a picture of this portal, because we cannot leave this panel without seeing this wonderful tool that they're talking about. So let me go on to some of our questions we gathered from our attendees here, where we've got some industry generic questions, patient sentiment questions, insurance verification, price transparency, patient billing, a couple of miscellaneous. There's another WixCorp question, and then there's some go live and support questions as you went live with this system, what you experienced. So let's get to those. And then we also, a reminder, if you came in late, we have a chat window. Please put any questions you have in chat for our panelists. So each of you have moved to a new patient engagement platform. What were you doing before, and why did you choose to invest time and energy into this project? Who wants to go for that? Brooke?
I can take that. So, like I'd mentioned in the beginning, we had kind of started down a different path because we were having some registration hiccups, and I think that's common with most facilities, just making sure that accuracy is correct. So we'd started down the path of that. But as far as when we started researching, and hopefully I'm addressing what we're saying, but we found it was much, much bigger than what we were anticipating as far as our needs. And if it's okay to share just a couple of examples, I won't take too much time, but one of the things that was a game changer for us is their texting platform. That enabled not only quicker reimbursements and communication back with patients, but we soon realized from a billing perspective that our billers were able to use this in communication with when we do need a COB update, or there's many communications in addition to our clinical staff and some other things that utilize it. But we were able to get quicker responses, simple questions, calls back, things as far as communicators, we were able to resolve much, much quicker than we had been in the past. And so for us, there were many elements as we got going through the process. Wix Corp literally customized some specific things just for us. I know they've done that for other facilities that we've been able to share and use some different ideas. But as far as that, there's been many elements as we've gone forward, including the price transparency and the no surprise billing, and many pieces of it that we have been able to take advantage of at a good cost savings overall.
So Brooke, you hit on actually under patient billing, one of the questions that's coming up. So let's just talk about that for a minute, about texting, billing information via texting compared to receiving a paper statement. Talk about, you're using bill information via text and receiving bills or payment via text. Are you working, do you do that?
Yeah.
Has that impacted your AR, your accounts
Definitely.
receivable?
Yeah, that we're seeing things come in a much quicker avenue. Deanna touched on, the fact that we're all aware, and, anybody in earshot that does this knows that people just simply don't open their statements as readily as they would look at a text message, or, I think even emails aren't opened as readily as a text message. So, as far as that goes, that has definitely been a game changer for us and on many levels.
Awesome.
If I could just chime in really quick about the text messaging. So for both Beaver and Milford, when we first started, I think we were just a little unsure how the text messaging was going to work, but we are definitely with Brooke. The text messaging has been a game changer for us as well. And we, on the administrative side, as you see the payments come in from those texts, so the text is sent out, telling the patient, hey, you have a new bill, click here to pay this, pay your bill. It's a lot of fun. It's a lot of fun to watch those payments come in, and without any work, the system just automatically does that for us. And so it's kind of letting the system work for us, and it has really been great. The one thing that my staff has used the text messaging for so much is just correct information for auto insurance. It's like, hey, we noticed that you had an auto wreck here at our facility. Could you get us your auto insurance and your claim number? And that has been really, really helpful for us. Workers' comp information. So I think we're in the day, in the day and age of anyone will answer a text, but they're not going to check their mail.
Awesome. Eric, did you have anything you want to comment on text messaging?
Just industry-wide, and really across industries, right? So whether it's healthcare, it's finance, it's retail, whatever it might be, text messages have, I think it's a 98% read rate. I mean, it's just absolutely ridiculous, but it's because we're trained, right? We get on our phones and we see the little red dot and we're like, oh, there's a message. I need to see what that is, right? And the banner that pops up with it, even if they're not reacting to it immediately, that awareness has been created, right? And it's helping build that transparency in the financial process so that even if they're not necessarily acting on that text, when it's followed up later with an email, it's followed up later with a paper statement, when it's followed up later with all those different interactions that the patient has with the institution, it just continues to build that transparency and trust in the process. And so over time, you start to see, I love how Brooke talked a bit about that trust, right? the first text that goes out, they're a little shocked. They're like, whoa, wait, why is my hospital texting me, right? And then the next one, they're like, oh, that's really cool. And then they'll respond to it, right? And they'll be like, oh, I'll respond to this, thinking it's just a dead text field, right? And then they get a response a few minutes later from somebody in the billing office that's like, yeah, here's your information. That level of care and concern builds that trust immediately with your patients. And it just starts creating those really cool experiences.
I want to go to Deanne for a second. And Katie beat me to the punch here. I was going to ask this question anyway, but she's 100%. She says, how are you addressing the elderly population with the new technology? Is this technology that's been implemented age banded? We talk about that a lot. Is it older people aren't able to handle the technology, or are they getting help from family members that are helping them through the technology? What's your experience, Deanne?
So that part has been impressive to me, to see the older population actually engage in it. And you can kind of tell, like when you're talking with them on the phone, how much they're engaged on being able to jump online. They want to see what their accounts look like. It's been impressive to me to see how much the older population is engaged with that. As well as even the ones that aren't, once they understand that process of and the trust that they'll put into that text message if they're receiving them, or the response back to just put their payment on file and have it just pay off any remaining balance, then that's another thing that they're trusting us as well as the system. And back on even just a comment on the texting itself, another nice thing is when the patients do get a text that they have a payment due, they can actually don't even have to log in, which is really nice. They can just put in a code and it pays, it reaches out and pays that payment, or they can click the link and actually go in and see the detail. So it's not a time consuming thing for the patients, which they love that part too.
All the relevant information's at their fingertips, sounds like. Yes. Awesome. All right, we're going to round robin here. Mindy, coming back up to you. So I'm going to jump around here a little bit, make sure because I don't think we're going to get through all these questions. There's just so much good information coming through all these. So what do your patients think of the new engagement platform? You mentioned that kind of earlier versus what you were doing previously. You kind of mentioned they were excited about that. You've got some comments on that. Talk about the difference between the old versus the new.
They love it. They don't want us. I mean, we did not have a patient portal at all for our patients before, but they really do love it. It's been so nice for them. We were able to reach out through our community. You had mentioned to begin with, we have 2 small communities, small hospitals, and we were able to reach out to them a couple different ways to let them know that this was starting. And we did some Facebook posts. That's kind of a way that a lot of our community, was able to hear about the new system. But wherever I go in town, people are constantly telling me how much they enjoy it and how easy it is to just pay their bill online. And one of the funniest things that I heard was like, oh, you're finally up with the times.
So was there a big educational hurdle you had to overcome with this, or was it just awareness?
No, really there wasn't. I asked Eric a lot about that to begin with, like, hey, what are we going to be up against? What are we going to, really, you know what, it's word of mouth, especially in these small communities. They talk to their neighbor, they talk to their friend, they are, they go to the doctor's office and they talk about it there. So really there was no education. Patients would call in and ask a few questions and make sure that, hey, I received this text. Is it legitimate? And then after that, it was great. It was easy and they love it.
Awesome. Eric, what do you see as far as metrics? What's the adoption rate look like?
I was just going to interject. Thank you, Clark. So Mindy's hospitals are kind of our new goal for every go live that we have. So they've been live for 3 months with us, and already 50% of all of their open AR has an account in our platform and is actively using it, which is just fantastic.
Astounding. Yeah.
Yeah. it really caught fire and took off very quickly. I think in the first month they had about 25% almost of active AR logged into the system and using it. Part of that's word of mouth. Part of it is just the go live process of trying to make that smooth and make it make sense with the previous billing cycles. If we get it just right, we get some really cool responses like we did at Beaver and Milford.
Awesome. Thank you. Brooke, coming back to you. So we talked a little bit about implementing a pre-service insurance verification process earlier. Was there a concern making the insurance verification process patient-facing, being that transparent with them?
Well, I think everything is always a little bit of concern that way, including like Deanne mentioned with the older population. I mean, there's a lot of concern with HIPAA. There's a lot of concern with, just basically other people tapping into information. That's kind of a hot topic right now. But as far as us, that was actually on our forefront. And I've kind of mentioned this a few times, but us having our patients see things patient facing is critical, because we have a lot of registration, a lot of users. And, in our world, there's more mistakes than what we'd like there to be. So we feel like the more patient facing things can be, the more correct that stuff becomes, because the accountability goes back to the patient when they're verifying that information or looking at it or things of that nature. So that was one of the things that we felt like it was very important to try to help train and, get our patients on board. Those of us who are in these critical access environments on these smaller communities, we literally in a sense of we had to retrain our patients. Mindy touched on this as well. Because we hadn't been really great in the past as far as collecting upfront copays. That was a little bit of an expectation that they had to resolve when we're asking for these. And so it was very important, again, to have that trust and communication and just kind of the upfront, things patient facing and that transparency, so that they knew these are our expectations now, and we want to work together and we want to be a good neighbor. So, there's kind of flip side conversation. It was been great. And I think we've had very similar experiences as what both Mindy and Deanne have described, but those are a few of our challenges, with things turning patient facing, but it's been received very well. And I can also speak to the positivity of people enjoying that and being able to see that and taking ownership of that.
Awesome. Thank you.
And I can just add to that, Clark, if that's fine.
Sure.
With that, a lot on the clinic side, when insurances are really moving away from a general copay, and it's a lot of co-insurance. So collecting upfront is getting harder and harder because of not knowing that end balance. We have a lot of our patients that, again, don't open their statements, and we work with an outside billing service at the end that patients can make a payment plan arrangement with. So really, people were just like, they'd get the statement in the mail, again, going unopened, and just these small, minute balances, $20, $25, were just adding up to this outsourced company. Whereas now, when they're getting that text notification that actually puts, hey, it looks like you're owing $15, click here to pay, the response on the clinic side of getting those smaller balances paid off the get-go has been really a big change, as opposed to just letting it be ignored on the patient side and letting it just go to the outsourced company.
So Deanne, let me give you a follow-up to that. One of our questions under price transparency, one of our attendees said, we provide a clear benefit breakdown to our patients prior to their visit, and patients tend to dispute their bills. What technique or strategy works best to decrease that issue?
Well, again, the disclaimer is it's just an estimate, so we try to really enforce that with our patients. And there is a lot of variables, but it seems to work out good when they can get on and see what the charges will be, and expect, some give and take on that. It seemed to be perceived well with the patients.
Eric, do you have any examples on that as well, on how to decrease the issue of patient disputes? I know it's just an estimator, right? It's not guaranteed.
Right. So there's a couple of things that we try to do. And part of it is just in the initial setup, trying to make sure that we're doing the research and we're looking at the right charges and going through and doing that CDM cleanup as part of the get up and go. If we just took what's in the EMR and put it out there, it would not be that effective. And so there is that kind of initial cleanup process of what do we want to put out there, as well as those discussions around especially procedures. So if you're doing a birth or a colonoscopy, there's a lot of codes that go into that. And so making the decisions around how do we bundle that and what do we put out there. So that first initial decision and data cleanup of what we're putting out there is critical. The next element that we found has made a really good impact, and certainly turn to the other panelists to discuss if they'd like, but adding that real-time insurance eligibility verification within that estimation so that we're able to say, here's expected charges. However, there's also these additional components with insurance, so your copay, your deductible, so on. And so letting the end user, whether that be the patient access team at the hospital who's talking to the patient, or the patient on their own, being able to put in that insurance information and get a good idea of here's what would hit your copay, here's your deductible, your out-of-pocket maximums, and having that conversation up front and moving those conversations further ahead in that process instead of trying to firefight it at the end makes a big difference. We also work really hard with partner institutions to try and clean a lot of that up. And so we actually just had a big press release today about a partnership that we have with MD Save, where we're able to take those bundled services from third-party institutions as well and pull those into the estimate. So now they can see both facility and third-party fees all right at the beginning, which is a really cool thing within the industry.
Yeah, that's amazing.
Eric, I just have one thought about that. I have noticed just with our patients that the more information we give them about the service that is going to take place, meaning, the cost, and here's what your copay will be, and you've met X amount of dollars your deductible, and here's the amount left. So being able to say to them, you have $500 left in your deductible, your copay amount will be $300, it's been really great. I think the patients knowing that up front before the time of service has helped with some of the complaints on the back end, complaining about that bill when they get it. Oh, I wasn't aware it was going to be that much. So we have noticed that with our patients, that's been a great tool.
I want to grab you for a second, Mindy. I want to back the bus up a lot. We've heard a lot about features and benefits and different things that are working. You were at some point that you needed to reach out. What made you reach out and find a solution, and what was your process to come to a solution?
So Brooke actually was the one that introduced me to Red, and then the process was simple. It really was. Eric's team was great. They're always there, hands-on. We can call them for anything we need. The process was really, really pretty simple. And in our industry, where Brooke and Deanna and I all work, we need to hear from other clients in our same situation, to hear that it was working well for them. So actually, Brooke was the one that turned me on to this.
So your relationship, the three of you, is association. You're in an association together. You're in geographical proximity. What got the three of you together that you could care and share what a solution looked like?
You want me to address that, or?
Sure.
So we're a part of the Rural 9. So in Utah, there are 9 rural critical access hospitals. And so we're part of, I feel like it's very unique. The people who put this together, Mindy's actually heads a lot of this up and puts a lot of the ideas, and we meet together twice a year in addition to monthly correspondence and just whenever it's needed. It's a super great resource for us. As Mindy mentioned, being in the same lanes with different things that we can reach out for resources, help. Some things in our hospital that we're getting to transition to. We've communicated out with Mindy and some other critical access hospitals to help us, with some things that we're moving forward with on some billing changes. And it's just a really great networking that I feel very lucky to be a part of. And I feel like more times than not, it's us being helped and having the advantage of reaching out. It's just a bonus. Occasionally we get to help as well, but it's definitely a good networking resource for us. We feel like that's what it's all about, is that communication.
That peer trust, as opposed to just reading something online and thinking it's going to solve a problem.
Exactly.
Awesome. Thank you. I want to make sure everybody's aware Eric is available to present to any association that wants to hear more information, like your association does. But Brooke, I understand there's kind of a funny story about how you approached addressing the price transparency legislation.
Well, I heard your statistic at the beginning of that. I think you said, 83% are not in compliance or something like that.
That's correct.
There was a little bleep in the back of my mind that's like, all right, we're okay. We're probably barely compliant, admittedly. We're doing our best to get through that. But, if anyone in earshot has been going through this process, either with surprise billing, price transparency, anything like that, at the time, this is, Eric, correct me if I'm wrong, but I feel like we're, 2 years into this now with that price estimator about?
Yeah, this is the second year.
Okay. So what had happened is he happened to be here and we were, I think, discussing something different and started talking about these are some challenges with the price transparency and how do we be a better partner in getting this out? And Eric was right on board and yeah, I can put this together. And I think at the time your team had already started something like that. It was in the works, but you customized it specific for our hospital. And it turns out we've been able to bounce off that with all this new Surprise Billing Act that's came about. So it just another reason to stay in communication and, ask the questions and be able to talk about it and talk about your needs. And you get some great feedback and ideas of, yeah, we can do that. So.
And Eric, you've had an announcement today then, right? With MD Save, we talked about that. Let's just touch on that again here in context.
Yeah, absolutely. So when Brooke first came to us, we had looked at doing an estimator and had talked about how we might integrate something like that, but it was a ways down our roadmap. And I think you came to us in like October and said it starts January 1st. We need some help. And so we moved that to the front of the line and got that out for you, which was a lot of fun and deployed it. But it's one of those pieces that as we think about patient engagement and patient experience, that's often one of the first touch points that a patient's going to have with an institution is understanding what service do I need and what's it going to cost me. And so we've been refining that and trying to grow and improve it, both to meet the price transparency legislation and then the now No Surprises Act legislation that's come out. Both have really complicated things within the industry a lot, and there's still a lot of unknowns around the No Surprises Act and just how all of that is going to get deployed. But trying to get ahead of that as much as possible really led to that partnership that we have with MD Save now, where they bring in those bundled services from the third parties and those elements that are called out within the No Surprises Act, being able to integrate that directly into the cost estimator so that you're knocking out price transparency issues, the No Surprises Act issues, as well as insurance eligibility and verification, all within one module, is the steps towards trying to help institutions meet those requirements and goals.
And so as those uncertain elements start to get visibility and light and clarity, you make adjustments, correct, to the system, and that
so things like the consent form that they'll need to sign off and how you have to send that with the estimate onto insurance companies, and there's lots of elements within the legislation that's still kind of getting worked out within the industry. And as they continue to refine and improve, then we'll pull those pieces together.
Awesome. So Deanne, how's the estimator working in your environment?
Well, with the price transparency, or the cost estimator, it's not only been helpful for our patients, but it's actually helpful in-house as well. That we use it when we need to look up a price. If we've got a patient that is calling us on the phone, we can look up and see the price easily there. Our charge master is very cumbersome to try to go through. So it's made it helpful on our end as well to be able to have that quick access to be able to plug in, whether it be, you know, that colonoscopy or knee replacement or whatnot, and be able to give the patients a charge.
Sounds like in 6 months we could have another roundtable here just on price transparency and estimator, just those two topics.
Well, can I just
Sure.
point, and just to add to what Deanne's saying, because of how our clinic and hospital is, Eric has put it so that, and this was touched on a little bit, but when a patient goes on there, they're able to see not only hospital, but the physician charge. So, you know, and that, like Deanne said, that helps us in-house too. You know, on our side where we bill for the hospital, I don't always know what those physician charges are. So, and, you know, perhaps vice versa, but it's helpful for us in a team sharing environment to be able to do that as to how our build is.
Awesome. Thank you. I want to jump into some patient billing stuff. So back to texting real quick, Eric, the difference between text to pay versus responsive texting payments.
Yeah, so there's definitely some nuance in the industry right now. So often when you hear things like text to pay within the industry, really what it means is I'm sending a text notification saying you owe a bill and click here to make a payment. And then it takes the patient from their texting, from the texting app in their phone onto a website or a portal, or takes them to download an application where they then have to go through that process, which is great, right? And we use that as well, where we'll send out those notifications with links. One of the things, though, that we wanted to do was try to make it even simpler to reduce the hurdles of getting patients to pay. And so we built out a text to pay that's a responsive messaging. And Mindy and Brooke touched, and Deanne, I think I'll touched on this a little bit, but the difference being, instead of sending a web link that the patient needs to exit their texting application to go do something on, we'll send them a note essentially saying, you know, hey, Sally, you have an invoice ready from your visit on the 15th with a balance of $50. If you'd like to pay that with your Visa on file ending in 1234, text back P1. And the patient then, still in their texting application, can just text P1. We'll then automatically go run that payment and then text them back the receipt. So the patient's never even leaving their texting application. They just do it by responding to that message, and then we take care of everything else on the back end. That process is a new, think of it as a new channel for payments to come in, right? So historically it's been, they can mail in a check, they can call you, maybe they can go onto an online application or portal. This is an entirely new channel where they can pay via text. They can just respond to that code and pay their bill. Depending on, so across all of our client sites, that new channel makes up about 10% of all of the patient transactions running through our system. There is a bit of a ramp up process, because the first one you send, like we talked about a minute ago, the first text you send, the patient's going to say, well, why are you sending me this? I'm not used to this, right? The second one, they try it. And then from that point on, they just use it almost nonstop. For like Beaver and Milford hospitals, where they're just starting and brand new to it, and they're only, I think, 6 weeks into taking text to payments, it's making up about 3% of their payments that patients are initiating. For Central Valley, where they've been live for a few years now, they're about 15% of the total patient transactions coming through the system are happening via text.
And is that increasing as we go on?
It's been a steady increase, absolutely. So I'm curious to see what they'll max out at. They're kind of slowly crab walking higher and higher. So it'll be fun to see a year from now if that's, you know, in the 17, 18, 20% range.
Okay. I'm going to go back to Deanne for this one. This is, again, one of our attendees. How do you help collect on payments, not just texting, but how do you help collect on payments that are past due? And how many years back are you able to collect payments on?
So I get on the notification, it tells them, hey, it looks like you've got a past due. And that's actually another thing is the the communication is nice and friendly on the messages that come, but it will say like, hey, it looks like you've got a past due balance, click here. And so that has helped a lot, as well as if they go online, it's easy for them to see what's a new balance, what's a past due balance, so they can take care of those and address those. And as far as collecting, there's no limit on the collecting as far as years back. Just that good PR, that relationship that we have, we try to, if it's something that's over a year old, we're a small community, and that reflects bad on us of sending out something that's older than that, unless we've had an issue with, say, the insurance for that long. But if it's something on our end, then we wouldn't.
Is it fair to say that the platform's created more visibility? So if you do have to send someone to collections, there's less of a surprise. That this does not come out of the blue, because you've got so many other ways of communicating to that patient now that they are not surprised
that's exactly right, because they can't use the excuse that, oh, I've moved, I haven't lived at that address for years, and they didn't get their statement because they've got it from that notification.
Awesome. Mindy, I want to jump to you for a second.
Sorry, I actually need to add something to that, please. Just because I feel like this is a good thing to mention as far as the collecting. We actually, by law, we're under the 501R standards. We've had Eric create a message that goes out at times with our statements, and it's also recorded. So when they go out, they're being informed that this is going out to a third party. So that's just to add on to the additional notifications that the patients are getting as far as collections. Every patient gets that's even being outsourced. So just kind of an additional. Sorry to interrupt.
No, that's actually part of what I was going to ask Mindy, and I'll ask Mindy now. This sounds like process and procedures. This changed your process and procedures by implementing the platform. What did that look like, and how was that transformation internally?
So it actually changed quite a bit of our process here in Beaver, and both in Beaver and Milford. I talked a little bit about the process change that we had upon admissions with real-time eligibility. The other big process change that we had was the collections process. We're allowing the system, Eric went in and helped us to make some templates that are, the patient is notified at 30, 60, 90 days. And then there's one last notification to them at the 120-day mark that talks to them about, without any action, that their account will be turned to collections. So our collection process has totally changed. And both of my ladies that work collections for me would never want to go back to the old process. And we have seen patients paying on bills that we have not been able to get. We haven't been able to get those patients to pay on bills for years. So the communication, obviously through the text messaging and getting them signed up on their portal, it really works.
Awesome. Thank you. We're going to run out of time before I run out of questions. So Eric, I promised that we would at least see some of the portal and stuff. So do you have that? So you can share that for a couple minutes, and I want to squeeze in a few more questions.
Yeah, I'm happy to pull that up. Let me share my screen here really quick, and I can give just a quick 30-second thing here.
If anybody wants a full-on demo of this, just reach out to me or to Eric, and we'd be happy to do a one-on-one to show you really in depth. But I wanted to at least put some tangibility to what we're talking about. So this is from the computer side.
Yeah, so everything's built in a responsive design, so you can do it on a computer, you can do it on a phone, or however. You can do just a quick payment where you're not actually logging in. You can just put in an invoice number or an account number and a date of birth, and it'll pull up that specific invoice. It'll let you see what they need to pay and let you pay it. Very basic, I know, and not lots of bells and whistles there. However, if you log into the system, once a patient logs into the platform, they'll be brought to something like this where they'll be able to actually get some of that transparency, right? They'll see, here's what you currently owe, here's what's scheduled to pay, here's what's still left to come. And then that transparency, right? So every claim that's out there will show, is it past due? Is it new? Is it out to insurance? Whatever it might be. And then from there, they can quickly make payments, right? So
and this can all be done in the color scheme and the logo for the individual client, so it looks like it's their system. It doesn't.
Yeah, it has to look and feel like that institution. So all the logos and everything will match up. And when they go to pay it, we hard code in the payment policies for the institution, so they can just select the plan that their specific invoice meets. They can use their card on file and take payments.
We could spend an hour just on that alone, being able to do payment plans right from the system, and take that out of the billing office having to manage those. Are any of you using the payment plans, and is that helping, Mindy?
So in Beaver, we use the payment plan option a ton. When Eric went live with us, we had a ton of patients on payment plans previous, so we were able to transfer those over into the system, and it's working great. The patients are also, we're kind of trying to push our patients to create their own payment plans now, and he was able to set the parameters according to our policies and what we want to make available for our patients, and so that was great.
That's awesome. Boy, we could spend a lot of time just on that. Eric, I wanted to make sure we covered the blended families and the complexity and dynamics that exist today. Can you talk a little bit about that, the difficulty with HIPAA privacy rules and keeping everything straight for everybody?
Yeah, so having just today's family dynamics can be really complicated. Lots of blended families with biologic children with one parent and biologic with another, and then a joint between the two new, and it can get really complicated really quickly. So keeping everybody HIPAA compliant while still making sure that it's really easy to use for the patient, so that they can log in, and from one login they can manage the entire family account and really only have access to those encounters and patients that they need to. That complexity can be challenging at times, and so we've worked really hard to build in the tools within our system to make it as easy as possible for patients to get in while still maintaining that privacy and compliance needs there.
Awesome. I want to make sure and get a couple more questions that our attendees had. So I'm going to jump to Eric. Anybody can jump in, but reimbursement forecasting. How does this system help, or can it help with reimbursement forecasting?
To some extent, it can, right? So we can show what's awaiting insurance right now. We take all of that AR, and we have a lot of reporting and analytics that we can pull it together and be able to show here's every penny that you are owed and where it's at and what stage, and give the tools to the team to be able to manage that. I think Mindy talked a lot about her team going in and managing those processes, right? So there's reporting and analytics in the system that can help bring some transparency to that. So anyway,
all right, I'm going to sneak in just one or two more. How does this process tie into anything that you do with external vendors? We talked about some external vendors potentially for early out collections or collection agencies, and how they might be able to use it.
Oh yeah, so I saw that question come through as well. So the concept there, right? So often institutions will have an early out company, and they'll have a collections company, and they have these existing relationships of how they manage, paper statement vendors and so on. And that's great, right? And all of those different institutions play a vital role within that patient financial experience. That doesn't preclude a lot of the things we were talking about here, right? So part of this understanding your business processes and putting the platform out there, it's trying to fit in just right within what you're doing, right? So I think it was Brooke that talked about that aging process of 30, 60, 90, and then, or Mindy, I'm sorry, it was Mindy that talked about that, right? So as the aging process happens, our platform can play a role in some of those early stages, and then as things continue to age, if the patient hasn't taken accountability for anything, they haven't done anything, then doing that increased touch with an early out company to do more proactive research and outreach, right? And then still no luck, then it moves on to collection agencies that they now have additional tools and resources they can bring to bear. It's a graduated process.
Two more final questions. Brooke and Deanne, what's been the impact to your AR after installing the system and using it.
You can go, Brooke.
Okay, I didn't know if you wanted me to address that or. So
Yeah.
as far as the impact to our AR, we've definitely, as far as our online service, I actually had Eric get us some stats. I wondered if we'd have a question like this, but like our online revenue has increased 54%. Like our checks are down 51%. There's many other statistics for us. You know, the numbers just speak for themselves, but things have increased over these last couple of years in ways that we were hoping, but we didn't know. You know, what you don't know, you don't know. You hope it changes, but it definitely has. Things have increased overall for, I know, the hospital perspective and the clinic. So yeah, it's definitely the transactions and things the numbers speak for themselves.
Mindy, your numbers, your AR, you've only been on 3 months, but have you seen any impact?
We have our credit card payments, so our, through the portal. I think, Eric, correct me if I'm wrong, but I want to say that we almost doubled our credit card payments the first couple of months. So huge impact.
Awesome. Last and final question for Eric. EMR platforms. What EMR platforms do you work with?
Yeah, so we actually do a lot of different integrations, and so we're currently live with companies like Cerner and Azalea and NextGen and Greenway's Prime Suite and Entergy and lots of other ones. We also utilize a third-party interface engine called Redox, and they're interfaced with literally dozens of different EMRs. And so getting turned on to an EMR is actually a relatively quick and as painless as an integration with an EMR can be, but we have a lot of tools and resources there to try and help make it happen.
Awesome. Well, I want to thank our panelists. I want to thank Eric for joining us. I want to let everybody know that the next steps here is to reach out to myself or to Eric if you want to see a demo, if you have specific questions we didn't answer. But thank you to everyone. And I want to thank all of our attendees for coming and taking the time today. We know how busy everybody is. So thank you. I appreciate it.
Thank you.
Take care.
Bye-bye.
Bye.